Hi, everyone. Let's get started. Aloha and welcome to the September Hawaii Public Health Training Hui webinar, Mental Health 101 Youth. My name is Melia Schneck, and I will be your facilitator for today's training. I first want to thank the organizers of this training, Makamai Namahoe, she is currently not here, and myself, as well as the Public Health Training Hui Steering Committee and Mental Health America Hawaii. These are our sponsors and partners who have provided today's credits. These are our continuing education credits that we provide. We have continuing health education specialists, registered dietitians, licensed social workers, as well as certified substance abuse counselors and certified nurses. To receive your continuing education credits, we would need you to complete your evaluation survey by September 25th. That is Wednesday. I will be sending out these surveys to the emails you used to register for today's training. And if you're joining us today by telephone, please email me at melia@hifi.org. That is MELIA@HIPHI.org with your name and your phone number used. I will be sending out certificates by October 4th, which will be 2 weeks from today. And if you have not received anything by October 4th, please reach out to me, the same email address, melia@hifi.org, MELIA@HIPHI.org. And for a few Zoom housekeeping rules, all participants are muted upon entry. For all questions, please use the chat box or the Q&A located at the bottom of your screen. This meeting is being recorded and will be shared on the Hawaii Public Health Training Hui's YouTube channel. You will also be sent a link to the recording in our Mahalo emails, as well as the slides from today's presentation. To finish, I want to give our speaker a brief introduction. Amanda Martinez, MPH, is the current Training Program Manager for Mental Health America of Hawaii. Since 2017, she has trained thousands of youth and adults in Hawaii with MHAH's Youth Suicide and Bullying Prevention and Mental Wellness trainings. She is also a certified trainer for Mental Health First Aid and Youth Mental Health First Aid trainings. Amanda received her Master's in Public Health degree from the University of Hawaii at Manoa, specializing in social and behavioral health sciences. She is interested in mental health wellness promotion among youth and young adults, especially among sexual and gender minorities. All right, that's it for me. Amanda, please take it away.
Thank you, Melia. Hello, everyone. Good afternoon. Give me one moment. Let me make sure I'm sharing my slideshow with all of you. As you just heard, you will get copies of these slides and a link to the recording. So feel free to just kind of, participate and be present as I move through the information. If you have any questions, go ahead and ask them. It seems like it's easier for us to track questions in the Q&A box, but I do like to try to keep my eye on the chat box too, just in case any kind of slip through there. But I encourage interaction in general. So if you have comments or want to answer any questions for today, or ask any questions for today, or answer ones that I ask you, go ahead and throw that in the chat box. It's great to see a lot of familiar faces, names, right? My brain is already on Friday mode, like ready for the weekend, right? But it's great to see some familiar names. We've been doing a number of presentations for you folks throughout the course of the year. So the one for today is called Mental Health 101 for Youth, or Youth Mental Health 101. This was developed by the organization that I work for, which is Mental Health America of Hawaii. If you have not attended previous presentations or have not heard of us for any reason, we are a nonprofit organization. We really try to help the community by providing community like mental health education for youth and adults. We do a lot of work in advocacy, where we help try to increase access to mental health related services, and then connection to resources. So while we don't provide any kind of direct resources from us ourselves, we try to help connect people to those services and to those programs. All right, so objectives for today, we're gonna take a look at what kind of an impact have we been seeing over the past few years in regards to mental health? So kind of starting around pandemic time, COVID-19, what kind of impact did that have on our youth? And then progressively over the last couple of years, how that has kind of changed a little bit as well. Excuse me, we'll be talking about what do we want to look out or listen for in regards to like warning signs, what kind of risk factors do we want to be aware of, like what can we look out or listen for, specifically related to our youth. Also talk about the importance of protective factors and coping skills and building kind of resiliency within our communities for our youth. And then, of course, connection to resources, one of our favorite things to do here at Mental Health America of Hawaii. And then we'll talk briefly kind of about a call to action. It's more something to kind of think within ourselves and reflect upon. Is that moving forward, what am I going to choose to do, right, to help support any youth that I may have in my life, whether it's in a personal capacity or in a professional capacity. Oops. Lost my, there we go. Okay. So what we have been seeing, okay, starting with COVID-19 and the impact on mental health, we absolutely saw an increase kind of across the board of a lot of things. Yeah, so increase in experiences of anxiety, of depression, and of sleep-related issues as well. So with sleep-related issues, everyone's sleep has generally been impacted by about 30 minutes, right, is what we've been kind of seeing from the research. And so generally people are getting 30 minutes less quality sleep every night, which builds up over time. Yeah, and our sleep is incredibly important to our overall well-being. So if people are getting about 30 minutes less quality sleep, that of course can have a pretty significant impact on someone's mental health and even possibly their physical health, which for our youth is incredibly important because they're still developing, right? Physically, emotionally, socially. And so sleep is really important in that process as well. So we had been seeing a lot of sleep related issues. We also saw a lot of anxiety surrounding like re-entry. So when we first started kind of like getting back together in large groups or moving into like a new sense of like routine and normalcy, we saw a lot of anxiety surrounding that, understandably so, right? Because it was a significant period of time where there was a huge abrupt disruption for our youth in regards to their routines and how we interact with each other, how they interacted with their peers. And you know, how can we do so in a safe way? Yeah, so a lot of anxiety surrounding that. We also have been seeing a lot of experiences surrounding grief. And, you know, that's something I think every single one of us has experienced some form of grief. And grief at its core is a sense of loss. Yeah, and that loss could be or have been, you know, the death of a family member, friend, or loved one. Maybe it was a loss of a relationship. Maybe it was a change in like family structure. So maybe there was a divorce, a remarriage. Maybe there was a parent who went into deployment or came home from deployment or incarceration or was released from incarceration. So that concept of grief, right, could look like a lot of different things, but we know it, of course, has an impact on people's mental health and overall well-being. And so if you weren't able to attend our grief and healing presentation a few months ago, feel free to go ahead and look at that recording and find out some more information about how to better support yourself and someone else who may be in that grieving process. Because I think that's really important for all of us to think about and to know that we do have that kind of support available, especially surrounding grief. There's also kind of newish terms, or at least to me, it was a newish term that came out. It was languishing. When I first heard that word languishing, I was like, I have no idea what this means. Yeah, so languishing means just kind of like that middle ground blah feeling, right? So someone who isn't completely motivated, you know, high energy, productive, and someone who isn't necessarily low energy, right? Not productive or motivated at all. It's that middle ground. Yeah, and so if you yourselves have been feeling that middle kind of blah feeling, the good news is, I guess validating news is, a lot of other people have been feeling that same way, enough so for them to actually assign a term to it. So we talked about, you know, that huge disruption that happened with COVID-19, which of course impacted rituals, impacted their ability to interact with their peers, which is so important for identity formation. We saw that grief, we saw double doses as well, right? Big transitions alongside with grief, alongside with those disruptions. But we did see some kind of silver lining things come out too, right? In that there are a lot more kind of conversations and awareness being shown on the importance of talking about mental health and prioritizing our mental health sometimes, especially amongst our youth and younger generations. It's like they want to talk about their mental health, right? And so we saw kind of an increase in mental health literacy. And for this, for that mental health literacy piece, I think it's, we've seen both the good and the bad sides of that. We want people to talk about mental health, but as supportive adults, we want to also help our youth talk about mental health in an appropriate and healthy way. And so when we talk about mental health literacy, it's not necessarily going on TikTok and then self-diagnosing myself, right? Oh, like I have ADHD now that I've watched this video because I think in this similar way, or I have similar behaviors as this person. So I must have the same kind of diagnosis. Yeah, that's not the kind of mental health literacy that we're talking about here and that we want to encourage with our youth. We want to encourage youth to, be able to maybe get some of that information and validation from social media, but to also have those conversations with parents or guardians, with doctors, mental health professionals who are the only ones who are able, right, to actually give a diagnosis. So, as supportive adults, we want to help our youth kind of sift through that information. It's not the end all be all, right? I for sure have this. I'm self-diagnosing when it comes to what we see on social media. Got to be a little careful with that. Yeah. We also saw really big increase in sense of belonging and how important that is, right? To feel connected to other people, to feel connected to a sense of community, whatever that community may be for that youth, and how powerful that is in supporting people's overall mental health and well-being, right? That sense of connection is one of the actually biggest protective factors that our youth have. Right. So Mental Health America as a national organization has been keeping their eye too on kind of changes and rates in regards to experiences of depression and anxiety, of suicidal ideation as well, and other kind of mental health challenges. So we have some free online screening tools that are available. You can access through our website, which you can see right there on the slide there. And so these online screening tools, I think, are a really great way to check in with ourselves. Our youth are able to take these tests. So you can see this kind of screen grab from youth who went online, right? Were interested in learning more about their own mental health. They're able to take this free online screening tool for anxiety and for depression. We could see that visual kind of increase in regards to both of these mental health challenges. And these are self-reported, right? These are help-seeking youth. So these are youth who are like, I think I'm struggling. I want to learn more about this. So I'm actively online searching, right, for different kinds of resources. So just something to keep in mind, right? But what has been interesting to coming out from these online screening results is that it wasn't just one reason behind this increase that we saw, especially around the pandemic time. Yeah. And what we've been seeing over the past couple of years too, is that it's a multitude of reasons behind someone potentially struggling with their mental health in regards to depression and anxiety. Yeah. It's, of course, the pandemic had a huge impact. It's also current events. I mean, think about the political climate of our country today, right? And how there's a lot of conflict, there's a lot of, arguments and people who are very like strong and passionate in their beliefs and where they stand. And that sometimes clashes with other people. So that has been taking a toll on people's mental health. Financial problems, right? Financial insecurity has huge implications on people's mental health. That kind of stress level of, how am I going to pay my bills? How am I going to keep a roof over my head? How am I going to provide for my family? And that kind of trickles down to the youth and children within that family unit as well, right? That's something that they also kind of experience, even though they're not the ones who are necessarily responsible for providing those things. They still feel some runoff of that financial stress. And then, of course, experiences of loneliness and isolation. Yeah, especially during the times where we had to physically distance ourselves from other people. Lots of loneliness and isolation, but we're also seeing different kinds of experiences of loneliness and isolation in regards to social media. Good parts and bad parts. Social media has the potential to reduce loneliness and isolation, especially for marginalized communities who maybe they don't have people in their area that they can connect to who have similar interests or express themselves in similar ways. So that's a potential benefit. But also, we know that youth are spending a lot of time on social media. So it's kind of, this echo chamber in a virtual environment where they're, consuming all of this content, they're interacting with people in a virtual manner, but once they put that phone down, they're kind of just sitting right with themselves. So it's a different kind of aspect of loneliness and isolation that we have been seeing as well with this. And so we also have been keeping our eye on Mental Health America as a national organization comes out with the State of Mental Health in America report pretty much every year. So we kind of update our research and statistics based on this, including a couple other kind of sources. But what they found from their 2024 report is that youth in Hawaii, about 17% experienced at least one major depressive episode, 9.44% experienced a substance use disorder. Now, of that 17% of youth in Hawaii who experienced that major depressive episode, almost 70% did not receive treatment, right? Did not receive any kind of help, which is pretty significant. Yeah, that's almost 3/4 of youth who did not receive any help. And major depression could have a pretty significant impact on people's day-to-day, right? It could really affect their ability to function on a daily basis. So we have been seeing this kind of disconnect between help-seeking behaviors and actually receiving and seeking help here in Hawaii, but really in the United States as well. Specifically here in Hawaii, there are a lot of barriers that actually make it hard for people to actually access mental health related services, even when they want them, okay? Let alone when that youth or their family unit is hesitant to connect to those services, or maybe they're hesitant to even talk about mental health, period, right? And so lots of barriers. Stigma is a really big one. I kind of touched upon that with the hesitant to talk about it, period. There's a lot of stigma that's still associated with mental health. So of course, what that does is it really silences the discussion. It makes people not want to open up and to talk about when they may be struggling with their mental health because they're worried maybe about their parents looking at them differently or treating them differently. Maybe they're worried about disappointing someone or being a burden. So, stigma is a kind of really one of the biggest barriers, at least in my mind, that prevents people from actually seeking mental health related services and support, even though they might be really beneficial for that individual. It could also be financial barriers, yeah. And so maybe that youth or their family doesn't have insurance, or maybe they do have insurance, but it's not, the best of coverages. So the services that they need are not covered under their plan, or the providers that they really want to go to are not covered under that insurance plan. Maybe they're not able to afford copays, or medications that they're being prescribed. This could also look like logistical barriers. So maybe they are in a place where, okay, I think I want to talk to a therapist. I've talked to my parents. They're also open to the idea. So we start looking, right, where to find a therapist who accepts our insurance, who's accepting new patients or new clients. And we find them. Awesome. We give them a call. We send them an email. And we're like, hey, I'm interested in entering into therapy. We hear back from that therapist or their office, and they're like, awesome, we're accepting new patients. Our next appointment is 8 to 10 weeks out. And you're like, awesome, right? 8 to 10 weeks is a really long time. And I'm in the place now, right, where I feel like I am ready to be able to talk to someone. So we know that there are long wait times when it comes to seeking mental health treatments and connecting to mental health professionals. If you're looking for like a prescribing provider for youth, that wait time could be anywhere from 10 to 12 weeks. So just some things to keep in mind, in regards to these barriers, especially if you're in a position where you are trying to help connect youth to services or programs or resources. You just got to be aware that it could take a minute. It could take some time. And so we got to build up that sense of resiliency and encourage youth to take care of themselves on an individual basis until they are able to get that appointment. And we've also seen almost 65% of youth aged 6 to 17 years old who are flourishing. And I think that's also something that we want to look for, is like the hopeful aspects, or the hopeful statistics in regards to research. So flourishing from this report is determined as a positive indicator of mental health and well-being. And so the criteria for flourishing were designed to assess, children, adolescents learning, their sense of resilience, and their ability to kind of self-regulate. So if they're experiencing things like negative emotions, how are they coping, right? How are they self-regulating in that way? And so for this report, youth who were flourishing were those youth who always or usually showed interest and curiosity in learning new things, right? In schoolwork or work in general, They were able to be productive, finish tasks that they may have started. They were able to stay calm and in control when they face challenges. Yeah, so this is kind of what they mean by the ability to flourish. And 65% is a pretty good number. Yeah, it's more than half at least. Okay, so we also have been keeping our eye on rates of suicidality here in Hawaii. We can see here that suicide is one of the top causes for fatal injuries, kind of across the board, but especially so for 15 to, all the way up to 44. Overall, it's a second leading cause of fatal injuries, and these are fatal injuries only. Yeah, these are deaths related to like car accidents, poisonings, drownings, falls. These are not deaths related to things like cancer or chronic diseases. So anytime I look at charts or graphs like this, it's always concerning, right, for me to see that that suicide is so high up there. Yeah. Someone does die by suicide about every other day here in the state of Hawaii. It's still September, so it is National Suicide Prevention Month. So a lot of awareness and conversations being had surrounding suicide prevention, right? We just had the Out of the Darkness walk last weekend. So, everyone kind of coming together who, maybe have lost someone to suicide or they themselves have struggled, where they just want to continue to raise awareness. And we were all able to get together as a community and just be present with each other. Yeah. And so I always try to look for little hopeful aspects, especially when we look at charts and graphs like this surrounding suicide. So what I want you to take away from this graph is that prevention works. Okay. We know that prevention works. If we think about car accident related deaths over the past couple of decades, we've seen those decreasing based on the amount of prevention efforts that have been put into preventing them, right? Creating safer vehicles, establishing traffic laws and policies, raising awareness about drunk driving and distracted driving. And we've seen the impact of those efforts, right? And so I truly think if we put the same amount of effort into suicide prevention, we would also see a change in these numbers here. And there's a lot of really awesome efforts that are happening across the state. If that's something that you are looking to learn more about or get more involved in, please feel free to reach out to me. I'd be happy to connect you with the folks who are in charge of the Prevent Suicide Hawaii Task Force or individual county task forces as well. We also get data directly from our youth. Yeah, so this comes from the Youth Risk Behavior Survey. And so these are youth in public schools every other year who self-report, right? Answers to all of these questions. It's a really big survey. They have a bunch of different types of questions actually, but these are the ones that are specifically related to suicidality. So from their 2021 report, which is the most recent that is available to the community, we see ideation, which is suicidal thoughts. Okay, so almost 27% middle school students and about 16% high school students self-reported having had thoughts of suicide in the past year when they took that survey. And then progressively, you can see the numbers for youth and students who self-reported making a plan and self-reported having made an attempt before. Yeah. And so again, concerning, right, to see maybe these high numbers, especially when it comes to thoughts, but hopeful takeaway from this is that you see these boxes and these numbers decreasing, yeah, as we kind of move along the spectrum of suicidality. And so that's what I want you to remember, is that not everyone who thinks about suicide, not everyone who makes a plan, not even everyone who attempts suicide actually dies by suicide. So there are opportunities, yeah, for us as supportive adults to be able to step in and help if a youth is anywhere on the spectrum here. Okay, so risk factors for substance use and abuse. I won't spend too much time on the next couple slides because I know these are all like research and data. Not everyone is a public health nerd, right? Like I am. I don't want to put anyone to sleep right midday already, but risk factors for substance use and abuse. Generally, if I could summarize all of these, it's a lack of positive connections, right? With peers, with supportive adults in their lives. And it's really turning to unhealthy or negative coping strategies. Yeah, is the kind of risk factors that we see that could increase the use potential to utilize substances or have that even turn into an actual substance use issue. We see that statistic that 50% have misused a drug once. So that's a national statistic for the United States. So just something to keep in mind. We also know that ACEs are important for us to be aware of. The Adverse Childhood Experiences study If this isn't something that you're aware of or have heard of before, I encourage you to look it up. It's a fascinating study. What they were looking for, what are those, risk factors or, childhood experiences that increase someone's risk, right? And so generally what they found is that the more ACEs or adverse childhood experiences that an individual had, so does the risk for negative physical and mental health, right? That risk increases. So more ACEs, the more likelihood that they, develop mental health challenges or, have physical health issues or even early death. Yeah, so really awesome study. And so I encourage you folks to look it up if you haven't had a chance to explore all of that. But they also highlighted some protective factors as well. And so what stands out here, I know this kind of a wordy slide, and you will get access to all of these, so you can kind of go back and look at it more in depth on your own time. But really what stands out here is protective factors, right? Safety and basic needs are met. Okay, so having a safe home environment to be in, food, okay, being able to be physically active, right? All of the, having clothing, all of those basic needs are being met, protective factor. Relationships and connections to peers and supportive adults and to a sense of community as well. Already talked about that as being one of the more important protective factors. And you can see that's also shown in the ACEs study. And then access to care, right? If it's more access to care and services and resources, then that is protective for our youth. So this is kind of just like another way to phrase the previous slide there on protective factors. But what has been interesting, I want to highlight really quickly, is that protective factors are actually more powerful and more impactful than all of those risk factors that we've been looking at or that we may be aware of. So, it is of course important that we are looking out for those things, right? Risk factors that could put someone at high risk. But it's almost just as important that we're also taking a look at potential protective factors. How can we build resiliency within our youth and within our communities to help support our youth? And a lot of these things are things that we generally have control over or the ability to kind of influence. Yeah. Whereas risk factors, those aren't always things that we have control over or that we can fix or influence, especially surrounding trauma. Okay. It's not like we can go back in time and stop that thing from ever happening or change the outcome of that event. But a lot of these protective factors, we have the ability to identify or bolster or even build in our youth's lives. Okay, all of that, right? All of that research and statistics. Now what? Or so what? This is one of my favorite slides in this presentation, is that now what, right? It's one of the biggest questions that we often ask ourselves in public health, right? Now that we've done all this research, we've identified and established that there are needs in our communities that our youth are struggling. So what are we going to do about it? Or what can we do about it? Okay. And so there are a lot of strategies actually that we can adopt and that we can implement in our communities to help support youth, whether it's on like an individual level or interpersonal level, helping our youth learn how to cope and to support themselves in healthy, positive ways, or even a community organizational level, right? Like what's a school doing or what's a workplace doing to help support the mental well-being of their youth and their students. On a community and societal level even, right? What are we doing as a community to come together? How are schools working with Department of Health, working with other nonprofit organizations to support the well-being of their youth? What kind of overarching policies and laws are being established and put in place to support the well-being of our youth, right? And so we're going to go through some of these strategies, but I did want to show you really quickly a clip from our No Shame Get Help campaign. So this is a campaign that we launched a couple of years ago. It's designed for youth, but I think adults can also benefit from this. So it's a really quick video. It's about 15 seconds long, but it just kind of highlights the importance of talking about mental health.
Hey, I noticed something's up with you.
How have you been? You doing okay?
I feel like you just haven't been yourself.
I thought we could talk about it.
I want to hear what you're going through.
And I got you.
There's no shame in getting help. Learn more at noshamegethelp.org.
All right, so a quick clip right from our No Shame Get Help campaign. And so you can see a couple messages in this video here. I always do this, always. And so a couple big messages from this clip here, yeah, is that we want to have conversations. We want our youth to check in with each other, with their friends, right? Ask how they're doing, how's school going, how's family life going, especially if they notice things, right? If they notice maybe some of their friends struggling a bit, the importance of checking in, but also that there's no shame in getting that help. I know that we live in a world today where we feel like we have to handle everything on our own, that we have to carry everything on our shoulders, and our youth may be hesitant to reach out for help because maybe they think, you know, I don't want to be a burden on people. My family and my friends already have their own problems. I don't want to put my stuff on them, right? My parents are already so stressed out, like I don't want to worry them in that sense. But there's no shame in reaching out for help. You know, the reality is that we've only made it to this day because we've done so together. And the only way we're going to continue moving forward is if we do so together as well. And there's no shame in asking for that help. I often tell youth when I go into middle school and high school classes and do presentations kind of similar to these, is that I think it takes a really strong person to be able to admit that I'm struggling and maybe this isn't something that I can necessarily handle on my own and I need support surrounding this, because that's not an easy thing to admit, let alone be open to accepting help from other people, right? But it's important that we do. And it, you know, if we have a friend or loved one come to us and they're struggling with their mental health and they need someone to lean on a bit, it's not like we're going to turn our backs and walk away. We want to help them because we care about them. And it works the same way for the people who care about us. And that's a really important message I think our youth needs to hear, is that you're not being a burden, right? And it's okay to admit sometimes when you may be struggling or when you need some extra help and support. Okay? So in regards to like checking in and looking out for certain things, when someone may be struggling with their mental health or a youth may be struggling with their mental health, there are general kind of warning signs that we want to look out or listen for. Mood dysregulation for 2 weeks or longer. I know that sounds really clinical, but it's generally, has someone been acting differently for a significant amount of time, long enough for us to take notice. 2 weeks is kind of a good benchmark. That's an indication that things have been going on for a bit, and it's a good opportunity to check in. Anhedonia is a really fancy word for talking about kind of an aspect of loss of interest, in the sense that the things that I used to really enjoy doing just doesn't have the same kind of feeling anymore, right? It doesn't bring me the same kind of happiness or joy or satisfaction or make me feel as productive. So maybe I stop doing them. I really start to pull away from that because it just doesn't feel the same. Any kind of expression of suicidality is a pretty big warning sign for us. Generally, we like to say warning signs are anyone who's having thoughts of suicide and they're expressing those thoughts in any way. So maybe it's verbally in conversations. I think it's rare that you'll have a youth just straight come out and say, I'm feeling suicidal. It might be more kind of indirect languaging that they're using. So you might hear things like the world would be a better place off without me, or I'm not sure how much longer I can take this or do this for, or unique kind of phrases that our youth are using, like unalive, right? Thinking of unaliving myself. I saw recently someone say, you know, I'm going to delete myself or expire myself. And so this kind of really unique phrases that we haven't quite heard in that context, it just gives us pause. That's an opportunity to check in and to find out more information. And then the rest of the slide is generally looking at how much of an impact is this having on a youth's day-to-day. If it's affecting their ability to wake up on time, show up on time to class, not just show up to class, but listen, pay attention, be engaged, learn new things. If it's affecting their ability to physically take care of themselves, so skipping meals, not being physically active, sleep disruptions, okay? Or it's affecting their ability to connect with other people. So you see it taking a toll on friendships and relationships with the people around them. Again, that's just a good opportunity to check in. So these are kind of general things that we have the ability to look out or listen for as potential warning signs that our youth may be struggling with their mental health, just in general. Okay, so I know I've been talking for a minute, and I do like to try to have some interactivity in these presentations. So we actually have a youth suicide and bullying prevention presentation that is available for middle school and high school aged youth. So side note, if that's something you're interested in bringing to your schools or organizations, reach out to me. I'd be happy to come in and talk about these things with your students or with your youth. But you know, in the development of that program, which has been around since 2008, so we've trained, I think, close to 35,000 youth and adults here in Hawaii in that curriculum. There's a bunch of projects that went into the creation of that. Okay, it's, you know, evidence informed. So we've been taking a look at, you know, recommended best practices for bullying and suicide prevention. But there was also a bunch of focus groups that happened too. And so youth all across the state of Hawaii were able to get together and share their stories and their experiences when it came to mental health, when it came to suicide, but also when it came to finding support and getting help for that and kind of moving through it and processing it in, you know, in healthy-ish ways, or healthier ways. And so I have from that project a couple quotes taken directly from those youth, and I thought I had it. So let me actually really quickly pull up those slides, but I have a couple quotes taken directly from those youth, okay? And so we're going to do a little activity where I'm going to pull up a quote for all of us to see here. And I want you to think about which quote this category belongs in, okay? And so the category choices we have are risk factor, warning sign, and support. And then we're going to pull up a poll for you to be able to vote. If for some reason you don't see the poll or you're not able to access the poll, you can just drop your responses in the chat and I can keep my eye on them as well. Yeah. And so when you read the quote, think about it. Does this quote sound like a risk factor? Is this something that catches my attention? Is this something that makes me think, I think I want to check in on this youth because I'm starting to notice something. So I think I need to gather some information and start to ask some really important questions. And then you'll vote for that risk factor category. So things like bullying, drug and alcohol use, and other kind of unhealthy coping strategies, abuse, right? Unsafe environments, things of that nature. If you read the quote, and it sounds more like a warning sign, so that things have progressed, right? From just maybe catching our attention, and now we're entering into the realm where safety is potentially an issue, then you're going to vote for the warning sign category. So examples of warning signs would be things like thoughts of suicide, someone talking about having made a plan, right? Things of that nature. And then third category, if you read the quote and it sounds like a good thing, it sounds beneficial to someone's mental health, then you're going to vote for the support category. Yeah, so hopefully that made sense. When I pull up the quote, you'll see the category options on the side. You'll also see them on the poll, which Millie, I'm going to ask for your help in just a moment to launch that for us. Okay. But the first quote I have for everyone is makes me feel better, distracts me, calms me, quiets me, takes me away from my problems. So what do we think about this? So we can launch the poll. And if for any reason, if that poll does not pop up for you on the screen, just go ahead and drop that in the chat. But I'll give you a little bit to kind of think on this. Does it sound like a risk factor? Does it sound like maybe a warning sign? Or does this sound like a good thing that I want to encourage youth to continue connecting to? Giving everyone, we like to wait at least until a majority of people have been able to cast their votes. So Malia, I hope you can see on the back end how many people have been able to vote. So whatever you feel is like a majority, go ahead and share the results with us. We can take a look at what everyone thinks. Okay, awesome. Thank you, Malia. And thank you for everyone for casting your votes here. So it looks like we got kind of across the board here. So we got about 9% of you say this is risk factor. We got 38% of you say this is a warning sign. And then we got 53% of you say this is a good thing, that this is support. So I'd love to hear your thoughts about this a little bit. I know we only kind of were limited to the chat box feature, but let's, since the majority of you voted for the support category, can I have some or a couple people drop in the chat why you thought that this was a good thing? Why does this belong in the support category? And then also for those of you who maybe voted for a risk factor or warning sign, maybe you could get a start on typing out why you voted for that category and why you think it belongs to that. So I do see a response in the chat, a couple of them actually. Okay, so this says it's something that makes me feel better, calms me. That sounds like a good thing, right? Especially for someone who feels overwhelmed. I'm hoping it's a positive thing they're doing that makes them feel better. Yeah, I'm hoping the same. Okay. It sounds like maybe a supportive hobby with a question mark, hopefully. Yeah. The statements are all generally positive. It sounds like healthy coping skills. Okay. But I also see calming strategies. Okay. But then I also see the folks who maybe voted for a risk factor or warning sign is that it doesn't really solve a problem. So if we're turning to these things to kind of distract ourselves, right, to avoid our problems, that's not necessarily a good thing. It could be pertaining to drugs and alcohol, might be substances, okay? Depends on what activity they're talking about. You are correct, right? Healthy distraction can be a support. I agree, right? It's good to distract yourself sometimes, as long as it's not something we're always turning to, right? To try to avoid our problems. Okay, so a couple other people say it could be substances, could be drugs. Okay, another person says, I don't want to necessarily jump to conclusions. So I would agree. It sounds like we need to ask some more questions here because we don't want to assume either way. Yeah. Okay, really awesome job. Thank you for everyone who put your kind of thought process in the chat. So when I do this activity with youth, because this is a part of our youth suicide and bullying prevention program, we see the split, right? Usually a majority of students will move into the support category because they assume, right? Or they think, you know, this sounds like a good thing. This sounds like hanging out with my friends. This sounds like listening to music, maybe going for a run or hitting the gym. But I'll always have a couple students or even a small group move into that risk factor or warning sign category because what if, yeah? What if this person is talking about drugs? Okay? What if this person is talking about self-harm? What if this person is talking about suicide as a way to take them away from their problems? Those are all concerning things. Yeah, those are not necessarily healthy coping strategies. And they really are things that sometimes could put a youth's safety at risk. Yeah. And so we need more information with this. Sounds like we got to ask some more questions here. Awesome job. Okay, next one we have is when I really know that my depression is kicking in, I want to die. So Malia, if we can relaunch that poll, okay, get your thoughts. Okay, so when I really know that my depression is kicking in, I want to die. So whenever we get that kind of majority of participants have that chance to vote, feel free to share the results with us. All right, so looks like we've got a little bit everywhere here. But looks like the majority of folks, about 80% voted for warning sign. We got 18% voted for risk factor, and then 1% for supports. Yeah. And so for this quote, I think is a little more kind of straightforward in both the risk factor and definitely the warning sign category. It sounds like this person is seeking support, hopefully seeking support, or that they are in need of support. Yeah. And so if you haven't already been able to tell with these quotes, there's a lot of different ways that we can interpret them, a lot of different perspectives that we can look at them. We know that depression is one of the biggest risk factors for suicide. So if you voted for a risk factor, you are not entirely wrong, right? It's definitely something we want to look out for. But I think that last part of the sentence, talking about wanting to die, like their depression is so dark and so deep that they think suicide is their only option or solution to end the pain, definitely pushes it into that warning sign category. Really awesome job here. Okay, last one. Yeah. I think that everybody has their own problems. You just have to try to get through it. There's a lot of stuff that I never thought I could get through, but I did. And now I don't have those same problems. So what do we think about this one here? Right, work on casting your votes. And then again, when we get that majority, feel free to share the results. All right, so it looks like majority of people voted 85% for support. We still got 9% for warning sign and 6% for risk factors. So maybe can I have some people drop in the chat why they picked the category that they picked? It could be either, you know, explaining your perspective and why this sounds like a good thing. This belongs in the support category. And then maybe that those couple people who voted for risk factor or warning sign is why you gravitated towards that category instead. All right. Okay. I see someone says it demonstrates resilience. I would agree. Yeah. And resilience is important. Okay. Okay. It sounds like this person has managed through their problem. Yeah. Definitely sounds like that, right? Using coping skills. There we go. Okay. Relating to the other person and sharing a common ground is a way to show support. Yeah, I'm getting that feeling as well. Person identified successful skills and support of continued use of skills provided or provides validation. Yes, yeah. It kind of sounds like this person maybe is connecting to a friend who may be struggling or going through a hard time, and they're trying to give them a little bit of hope, right? Like when I was struggling, when I was going through my own problems, I felt like this wasn't something that I was able to get through, but I did, right? And here's how I did it. And so providing a little bit of hope maybe to someone else. Yeah. So yeah, it sounds like they want to be supportive to those who are experiencing problems. It gives the other person who's going through a hard time courage and strength, right? That they'll get through it, that even if it doesn't feel like it right now, that there is supports that are out there. There are ways for you individually to cope in a healthy way, but there's also resources and support out there. So thank you so much for everyone who were able to cast your vote and kind of explain your perspectives in the chat. I agree with pretty much what everyone has said. Almost all of these quotes that we have, we could argue, right, or justify almost all of the categories, right, depending on how we look at it. But I only pulled out 3 quotes for all of you. I actually have a whole envelope full of quotes, right, just like these ones, very similar kind of experiences and stories. And these are all real people, youth here in Hawaii, who participated in this project and who went through some really hard times, even struggling with suicide. And they were able to make it through. They were brave enough and gracious enough to share their stories with us so that we can utilize it in an activity like this, so that we can continue to raise awareness and give you all a chance to practice. So it's not just me coming on this Zoom with my beautiful PowerPoint slide telling you like, what do you want to look out or listen for? But you can actually hear it and read it in the way that youth might phrase it, or you can identify potentially concerning behaviors, yeah, that our youth may be engaging in that catch your attention and make me think, I think I need to check in with this youth and see that they are, or make sure that they are connecting to the supports that they need. They're going to be beneficial to them. So thank you everyone for participating in that activity. All right, so when we talk about checking in, there are some things that we want to do that facilitate connection, and then there are things that we want to try to stay away from because they actually facilitate disconnect, right? They don't really open that door or create that safe space for conversations to happen. Yeah. So I'm actually going to start on the left-hand side, which is our disconnect, the things that we want to stay away from. So we want to stay away from minimizing feelings and experiences. We want to try to be validating instead. And I think one of the biggest examples I usually bring up in regards to minimizing feelings and experiences are breakups. Yeah. And so let's say there is like a 13, 14-year-old first relationship, it's their first breakup and it's devastation. Yeah. Total heartbreak, just really distraught about it. But what are some things that adults might say to this youth to try to make them feel better? What are those kind of like common phrases that we often hear? Feel free to drop those in the chat. All right. Yep. Coming in hot with the you'll be fine. You're young, right? You'll bounce back. Don't worry. There are plenty fish in the sea. Oh my gosh, yes. Right? The plenty of fish in the sea one gets me every time. I understand what you're going through. It happened to me. Yeah. I remember my first breakup. Here's what you should do, right? Here's how you should handle it. One heartbreak closer to happily ever after. Okay, so you gotta go through some of those heartbreaks and some of those negative experiences to experience that true love, right? The happily ever after. I play songs like I'm a survivor. Okay, yeah. When door closes, the other opens. This too shall pass. So we got kind of maybe those platitudes, or I like to call them those like Hallmark greeting cards that we often see, right? Time heals all wounds. Okay. And these are the common kind of phrases that we often hear being said to youth when there is a breakup. Like, you're young, you don't really know what true love is. You just wait, right? You haven't experienced true love yet. There's plenty of fish in the sea. You'll fall in love again. You're going to meet so many new people. Might even experience heartbreak again. Yeah. That's a part of life. Or maybe we say, I didn't like them anyways, right? You deserve better. So most of these phrases that I've been seeing and strategies and approaches in the chat really speak to minimizing feelings and experiences. But there were some really nice ones I did see in there, right? Doing something nice for yourself is a good one. Playing songs like I'm a Survivor. I love music. Yeah, music I think can be a really awesome and healthy coping strategy for our youth to turn to. Okay. And so, they wanted that emotionally distant, non-committal salmon. Like, that was their fish. And now that they don't have that fish anymore, that's a very real experience for them. And we just want to be respectful of that as a supportive adult. Yeah. And so we want to tell them things like, it's okay to be feeling the way that you're feeling. Breakups are tough, no matter how old you are. Okay. It's natural for you to feel confused, hurt, upset, frustrated, angry, whatever it may be, but you're not alone. I'm here as someone that you can talk to. There's also people out there who specialize in things like this, right? Maybe they can help you have a different perspective, a different way to look at it, or maybe they can teach you skills so that you're able to cope and, kind of self-regulate and make yourself feel better, especially if you're stuck thinking about it all day. It's hard to focus on anything else, or maybe it's impacting your sleep, right? You're up all night. You're just thinking about how much this breakup is impacting you. Maybe talking to someone who specializes in things like this can help you learn skills so that you're able to sleep. Yeah, you're able to pay attention throughout your day. We want to stay away from asking questions with embedded or implied answers as well. I'm actually going to put a pause on that one until we get to the right-hand side and we talk about the importance of asking direct questions, especially surrounding suicide. We also want to stay away from offering false reassurances. So things like, you'll feel better tomorrow. Okay? We don't know that. We can't predict the future. Tomorrow can be even worse than today was. So if we say things like, you'll feel better tomorrow, and that person or that youth feels worse tomorrow, then we're breaking that trust. Yeah, making those promises that we cannot keep. And we also never want to promise to keep it a secret either. Okay, if you work with youth in a professional capacity, chances are you are mandated reporters. So you are legally obligated to report abuse if a youth is in danger of hurting themselves or hurting other people, dangerous situations. But I think that's just good kind of approaches and ways of thought that we should all have, right, as adults who support youth, especially when it comes to suicide, is that it's not the kind of secret that we should keep. If safety is ever an issue, we want to be able to connect that person to resources and to people who can help keep them safe. We also want to try to stay away from making it about us or oversharing. I know that there is a way to validate and help someone feel less alone by, talking to someone who has similar experiences or shared experiences. We just have to be careful that we're not pulling focus. Yeah, that we're not making it about us. Ultimately, it is about them, and we want to hear more about their story. We can leave it up to them. I've gone through something similar. I've gone through breakups before. If you want to hear about my experience or you want to hear about how I got through it, I'd be happy to share that with you. But I want to talk about you. Yeah, I want to hear how this is affecting you, what your experience is, and see if I can help. Okay. Which I think is a nice transition into the right-hand side, which is the connect side. Yeah, what facilitates connection when we're checking in with someone is the importance of listening. Listening is one of the biggest skills that we have available to us. And sometimes that's all someone needs, is someone to just listen to them. Okay? And when we talk about listening, we want to listen with our entire bodies. Okay? We want to listen with our ears, with our eyes, with our hearts, with our stomachs. And I know that probably doesn't make a whole lot of sense, But what I mean by that is listening with your ears. Okay. So listening to the things that people are saying, maybe what they're not saying. Sometimes we have to read in between the lines a little bit. We're listening with our eyes. We're paying attention. We're being observant. Are there changes in patterns and behaviors that I'm starting to notice? What's body language like? Yeah, does someone seem uncomfortable? Do they seem upset or distressed? We also want to listen with our hearts and with our stomachs. And I know it's not like a super scientific thing for me to say, but if something that someone says or something that someone does just doesn't quite sit right with you, it gives you that bad feeling in your stomach, don't just ignore that. That feeling or that instinct could be there for a reason. So ask more questions and let them know you're asking because of that. You know, like I'm just, I just have this feeling. I'm concerned. My utmost priority is keeping you safe. Okay. And so let me ask, right? Are you sure there isn't anything that you want to talk about, right? Or there isn't anything that you're experiencing that could make you unsafe? Okay. Okay, so I see how common in the chat, like my child would tell me, listen to me with your eyes. I have, yeah, like look with your eyes, not your mouth when I ask like my partner where something is. Yeah. And so like, listening is important, but there's a lot of aspects that goes into listening. It's more than just sitting there and letting someone talk at you. Yeah. It's listening with our eyes. It's being observant, right? Paying attention. Sometimes this is asking questions as well for clarification, right? Maybe it's, I just want to make sure that I'm understanding you correctly. Can you tell me a little bit more about what you meant when you said this? Or, I just want to make sure we're on the same page. Yeah. Can we talk a little bit more about this piece or about what you said with this? So, asking questions for clarification shows that you're listening, right? Shows that you're working together to continue this conversation and that you're there for the other person. You're there for that youth. You really want to know what's going on with them. And you're together trying to figure out ways to either like generate support between the two of you or connect to resources that are available if that's needed. Be non-judgmental during that entire process as well. This takes focused effort to be like non-judgmental, especially if there are things that maybe we have certain biases about, or we have really strong opinions or beliefs about. If those are not things that you're able to set aside in order to be able to connect and listen to a youth, then maybe you're not the best person to connect and have that conversation with that youth. And that's okay. Yeah. Listening and being a good active listener takes some self-reflection too. Okay. And there's no one perfect person out there. There's no one perfect fit. Maybe there is a better fit out there for that youth to be able to connect to, but at least you know that because you did that work yourself to kind of self-reflect. And, this isn't something that maybe I think I can put my judgments aside, put my beliefs to the side in order to help support them. So let me talk to my coworker or colleague. Maybe they're a better fit to check in. Okay. Asking questions is important, right? I already touched upon kind of asking questions for clarification, making sure you're on the same page. If we are concerned that a youth may be suicidal, we also have to ask those direct questions. And this is where I'm going to circle back to asking those questions with embedded and implied answers. If we suspect that someone may be suicidal, we have to ask, are you thinking about suicide? Could you be thinking about taking your life? And those questions are direct on purpose, okay? We want to know the intention. I think sometimes people stop at you're thinking of hurting yourself or you're thinking of harming yourself. I think those are good questions to ask still. We want to know, right, if someone is thinking about hurting themselves, but we also have to take it a step further and specifically ask about suicide, because those are two different things: hurt and harm and suicide. Okay. You can ask someone, are you thinking about hurting yourself? And they'll say no. Your next question could be, are you thinking about suicide? And they'll say yes. And to us, it's like, what? Like, hold on, like short circuit. I don't really understand the connection between that. And so, self-harm and suicide are two different things. The intentions are different, and the perspectives could be different too, because someone who is suicidal, they see suicide as a way to end the hurt or a way to end the pain. They're already hurt, they're already, in that pain. And so suicide is not adding more pain, right? It's not hurting or harming themselves. They're looking for an end to that. So that's why it's really important for us as supportive adults take it that step further and ask that direct question. And we don't want to ask it like this, right? As an example, you're not thinking about suicide, are you? If I ask it like that, it's written all over my face. It's written in the tone of my voice that the answer I'm looking for is no. I even shook my head. right? And so sometimes this takes practice. If you haven't had to ask a question like this, I encourage you to practice, whether it's with yourself, whether it's with a friend, coworker, colleague, just asking the question. So you don't have to create an entire role play surrounding it, but practice asking that question in a way that's direct, okay, that's addressing suicide, but that you're exuding that calm demeanor, even if you're not super calm, right? Even if you're not super confident, that on the outside you appear so, because that's incredibly important. You asking a question like this is not putting the thought in anyone's head. I know that's a myth that we've heard before, that I don't want to ask this question. I don't want to talk about suicide because I don't want to plant the idea in someone's head. And it doesn't work like that. We don't have that kind of magic power. We don't have that much influence, right, on human nature to have someone think about something that they're not already thinking about. If we don't ask, then we don't know. And if we don't know, how are we supposed to try to help that person? There's a lot of really other great trainings out there that help you practice asking this question, that go a lot more in depth in suicide prevention and intervention beyond just this presentation here. So if that's something you're interested in learning more about or taking those trainings, feel free to reach out to me, okay? We can go ahead and connect you to those in the community who are offering those trainings, if it's not me or us with Mental Health America of Hawaii who are offering it. But it takes some practice, right, in working in suicide prevention. And being calm is important. If you haven't taken youth mental health first aid before, it's a really awesome training, but they describe the step of being calm, especially when asking direct questions about suicide, is being a duck floating on water. And when I first heard that, I was like, what kind of training tells you to be a duck? Yeah, but it kind of makes sense thinking more about it, because on the surface, the duck is just chilling, right? Floating, gliding gracefully across the water. And underneath the water, the little feet are paddling. We don't always see that paddling happening, right? And so as supportive adults, especially in a crisis, or we think that someone may be suicidal, we want to be the duck. On the outside, we're modeling that calm demeanor. The inside, we're paddling. Now, whether that paddling is paddling to manage our own anxiety levels, because this is a scary question to ask, I'm not quite sure what to do if the answer is yes, or we're paddling thinking, what is my next question? What is my next phone call going to be? How am I going to keep this youth safe for now until I can connect them to a professional who could be more involved in that safety planning or long-term safety planning and support. Okay? We also want to act our age, which seems obvious, right? We don't want to pretend to be we're in an age, right, that we're not. But what we mean by acting your age is also being accepting, being genuine, be empathetic. Youth are very observant. They can see right through us when we're not being genuine. Okay, we're not being ourselves, or we're not being truthful in our genuine care and empathy. Yeah, so be yourselves, act your age. Use I statements to help guide you through these conversations, because it can be quite easy to forget what to do, what to say, what to ask, especially during difficult conversations. So you can fall back on those I statements. I noticed that you haven't quite been yourself lately, and I just want to check in, make sure everything is okay. I noticed that you seem upset or distressed, and I just want to make sure everything is all right, And in the course of that conversation, I noticed some warning signs, right? I noticed that, people who say the things that you've been saying or who engage in behaviors that you've engaged in, that they sometimes have thoughts of suicide. Are you also having thoughts of suicide? Okay. So you can fall back on those I statements to guide that conversation, to guide that question asking. I statements send the message, I see you, I care about you, and I want to help if I can. And know what your organizational protocol is. If you don't know what your organizational protocol is, now would be a good time to find out what that is. And if for any reason your program or organization doesn't have a procedure in place, now is a good time to put one in place before you're in the middle of a crisis and you're like, I have no idea what to do, right? And so know what that process is for dealing with the youth who may be in crisis. All right, so I know we're kind of coming up on time. I just got a couple more slides to go through, and I do want to make sure I leave time at the end for questions as well. Support plans are important. Support plans are not just for people who may be in a crisis. They should be used by everyone. We should all have some idea of what our support plan is, yeah? And we can help a youth develop their support plan too. Who is it that they know they can talk to when they need help? Who is it that they talk to because they feel better after they do? They have a friend who's super funny. They find the best TikTok videos. They send the best memes. I just feel better after interacting with them, right? because we have different types of connections that we can rely on at different times. If they have providers in their life, do they have their contact information on hand, including crisis resources? I always encourage people to put crisis resources in their contacts, right? Program them right into your devices so you have them on hand just in case you find yourself needing to call or contact one of them for yourself or for a friend, okay? And then help them explore those kind of bigger questions too, like, who am I? What kind of person do I want to be? How am I treating the people that I have in my life? What kind of impact do I want to have? What kind of footprint do I want to leave behind? Encouraging our youth to take care of themselves too is also important. This is also an opportunity for us as supportive adults to help brainstorm this. What does your support system look like? Yeah. Who are those people, right? Like we were just talking about. Where are those places? Where do you go to take care of yourselves? Where do you go to feel safe? Where do you go to feel better, to relax, to unwind? Where do you go because you like going there? It makes you happy. You look forward. And then what are those activities? What do you do to make yourselves feel better when you feel down or upset? What do you do to help calm yourself down when you feel angry, frustrated, overwhelmed? What do you do because you enjoy it? You like it. It makes you happy. Yeah. So being able to identify these people, these places, and these activities is creating that visual kind of support system. And sometimes it is writing it down, right? Having them keep a list on their phone so that they know these are the people I can go to, these are the places I do go to, and these are the things that I can do, right, to take care of myself. Self-care for you is also incredibly important. This is hard work, interacting with youth in general, supporting youth in general. Make sure you're taking care of yourselves too. Thank you for everything that you already do, okay, in your various capacities and your programs and organizations. Make sure you're taking care of yourselves. The only way you're going to continue being able to do the good work that you're doing is that you have to take care of yourselves, right? To be sustainable, to continue to be effective. There's a lot of different pieces that make up the practice of self-care. You can read them and kind of go more in depth with them when you get access to these slides later on. But we also have several kind of recordings on our YouTube channel. If you want to learn more about self-care or resiliency, you want to learn more about specific coping skills, feel free to check those out. And I also have the handle to our YouTube channel somewhere in this presentation you'll be able to find, but it's incredibly important for all of you. Yeah? Another aspect of taking care of ourselves is the importance of finding hope, okay? And so we won't be able to do this kind of online word cloud that I generally do with this presentation. So I just want you to kind of think and reflect on this, yeah? What has given you? What has kept you going over the past couple of years? Or maybe has that changed, right? Maybe what has given me hope before looks a little bit differently now because the world is the world. Yeah, it's kind of all over the place right now. And maybe what worked for me before isn't having the same kind of effect. So I had to switch things up, right? Or maybe it gave me a different perspective, or maybe I have different priorities now. And that's okay, right? To kind of see that changes, or to see those changes in regards to hope. But hope is incredibly important. It really is what gives our life meaning, what keeps us moving forward. If someone doesn't have any hope, or they feel really helpless or stuck or trapped, that leads to a really dangerous situation, right? That hopelessness and helplessness could lead to a dark place. So we want to be able to identify hope in our lives on a regular basis. Skills learning and sharing. I mentioned that we have recordings of all of these things on our YouTube channel, but a couple of our favorite skills to share and pass along are deep breathing, diaphragmatic breathing exercises, and the dive response. So diaphragmatic breathing exercises are my personal favorite. It's something that you could do no matter where you are, no matter when you need it, without drawing too much attention to yourself. And then the dive response, I think I've talked about it almost every presentation that I've done in this series for you folks, but we have it recorded on our YouTube channel as well. It's really activating that gland inside of our nose. It's a backdoor to our nervous system to calm down immediately when someone really feels overwhelmed. So getting that cold wet rag, laying it over this portion of your face will activate the dive response and help someone start to feel calm almost immediately. And then call to action, okay? Advocate, continue advocating for increased access to mental health services, stand up to microaggressions and try to break through that barrier of stigma, right, when it comes to mental health, okay? So when people say things like, oh, you know, someone who is experiencing depression, they're just lazy. Yeah. You know, that's not necessarily true, especially when it comes to major depression. Sometimes it's physically impossible for someone to just get up and get out of and get their day going. So providing that information to stand up to those microaggressions and provide kind of information to the community in regards to what does depression actually look like for some people, and help normalize mental health in your community. Our youth are kind of already doing this, right? And so as supportive adults, we would just want to help them do that in a healthy way, as I was talking about in the beginning of the presentation, of not like self-diagnosing from TikTok. Yeah. But having healthy and normalized conversations about mental health and being able to identify those resources. Maybe that's taking screenings ourselves or having our youth take those free online screenings, which you can also access through that bit.ly link that you see on the slide. Building community resilience, right? So really focusing on those protective factors and what are we doing on an individual, interpersonal, organizational, community, and societal level to really build that resilience up in our communities. And then take trainings, right? Find out more information. You all are already doing this by showing up today and letting me talk at you for a little over an hour, right? About all of this stuff. So when we talk about call to action, I want you to think about what this looks like for you. Moving forward after today, what are you going to do, okay, to be able to help support the youth that you have in your life, whether it's in a personal capacity or professional capacity? And it doesn't have to be anything grand. Yeah. It doesn't have to be a huge grand gesture or anything like that. It could just be an agreement with yourself that moving forward, I'm going to try to be a better, more patient listener. Okay? So think about what that call to action is going to be for you. I know that there are resources that are available. Again, you'll get access to all of these slides here with all of these resources. They're important to know about. We have 988, which is kind of the National Suicide and Crisis Line. We also have Hawai'i Cares, which is our local crisis line and center. We have Crisis Text Line. The Poison Control Helpline is also one that people don't always think about right away, but one of the more common methods for suicide attempts in Hawaii actually is with poisoning. So knowing what that number is, having that on hand is important as well. This is just like a you know, social media kind of grabs of other kinds of resources that are available. The Trevor Lifeliner project is one of my favorite ones to share. Helps to support our LGBTQ plus youth. We also have the Trans Lifeline as well. Different apps that are available too to help support someone's well-being, encourage them to practice self-care, or even take a look at their sleep hygiene, which is a CBTI app. So both of these apps actually came out around COVID time. So I'm not sure if both of them are still free to be able to download and use, but these are just examples. There's so many apps that are out there that help you kind of keep track of what you're doing for self-care, and that our youth can download and help them kind of take a look at, you know, what's my mood like from day to day? What are some coping skills that maybe I can utilize when I'm feeling a certain way too? And here's all of our social media handles. That QR code will also take you to those free online screening tools. So you'll have access to all these slides. Our YouTube channel is the one I usually like to highlight because that's where we house recordings of most of our previous trainings, and self-care and resiliency trainings as well. So it's a really great resource for you yourselves to take a look at, or to even share with youth, right? For them to take a look at and watch if they're interested in learning more about mental health or how to take care of themselves. And then here's our general kind of contact information as well. Malia, when you send out these slides to everyone and the link to the recording, feel free to include my email on there as well. It's really just amanda.martinez@mentalhealthhawaii.org, but that info@mentalhealthhawaii.org will also make its way to me. But that's pretty much all that I have for you in regards to information-wise. And so I think it's a good time to open it up to potentially any questions that folks might have, or even comments if you want to drop them in.
Yeah, so if you have any questions, feel free to drop them in the chat or in the Q&A box. But Amanda, if you don't mind, I'd actually love to kick off the Q&A. I was wondering, you talked about how those on social media talk about suicide in interesting ways. You talk about like unaliving and deleting themselves. I was wondering, how do you think that exposure to suicide in this way, you know, as a punchline or as something almost comical, can have an impact on youth mental health, especially maybe if this is their first time really hearing about suicide for the first time?
Yeah, that's a great question, Malia, actually. Thank you for asking that. So a couple things there. I think raising awareness about suicide prevention and talking about suicide is important. It's one of the first steps when it comes to suicide prevention. It's actually having open and honest conversations about suicide. However, I know that sometimes the way people talk about suicide varies. Yeah, it could be on social media, it could be just in everyday conversations. Personally, I know that a lot of my friends, we we utilize dark humor a lot. Yeah, we can self-deprecating humor, all of that, and we kind of joke around a lot. And so I do have some people in my life who make jokes about suicide, or not necessarily like making fun of it, but it'll be some like, oh, some like something happened in my day, so like I might as well just go die, right? Or go kill myself. And so I think those things, like those kind of jokes, or people who talk about suicide in that way, it's a teaching moment opportunity. Yeah. In that suicide is something that we should be taking seriously every single time. So if someone is talking about suicide in like a joking manner, it sends a message that, it's kind of like a lighthearted thing, or maybe this isn't something that this person is actually serious about. And so when I do have people in my life who talk about suicide in a joking way, I always try to make sure I circle back to them. It's not always in that moment, because especially the people I know well, I know that's just kind of like how they are, right? And how they communicate, how they talk about things. But I generally try to circle back at some point and be like, hey, like I know that maybe you were just kind of joking when you said this, but I just really want to be sure just in case. Yeah, you weren't joking this time. And if you're feeling suicidal, there's resources out there. I could be a listening ear for sure. But I want to make sure that you're connected to someone who can help you take a look, right? And address those potential thoughts of suicide. And it is something that we should be taking seriously every single time. So when I hear those kind of jokes or lighthearted, remarks about suicide, again, I think it's a teaching moment opportunity. And we want to send the message to youth as well to take this seriously. And that kind of change in the types of language that people have been using is important for us to pay attention to. I'm not super on social media. Actually, I've taken a pretty big break from social media, so I don't always feel super connected. But if I'm able to learn and know that language that youth are using now, you all can too, right? To kind of pay attention to things like unalive or delete, right? Or expire myself, and just ask more questions. Yeah. Thank you for that, though.
Of course, thank you for the really thorough answer. I really appreciate it. I actually have one more question if people don't mind me taking up this spot. So this is more from the perspective of people who may find themselves working with youth, mayhaps as if they are a mandated reporter. And at least when my experience, I used to be a domestic violence advocate with the YWCA. And so sometimes you'd find yourself talking one-on-one with a youth, and you may find yourself in the role of support, and this youth maybe does not want to get their parents involved. And I was wondering, Amanda, how might you suggest we navigate that process if they don't want us to get in contact with their parents at all? They don't want to kind of like loop their parents into this conversation. Do you have any advice for that, situations like that?
Yeah, thank you for that. That's also a really great question, because that's real, right? There's youth who maybe are scared to involve their parents, loop their parents in. I think ultimately the best approach to that is to be transparent, to be honest. Yeah, right up front, right off the bat. That there are certain policies and procedures that we have within our organization that if you tell me certain things, I'm legally obligated to report them. However, these policies and procedures are in place to keep you safe. That's our number one goal, is I want you to be safe, right? And we just want to make sure that you are. And so when we talk about having to call your parents, or calling the crisis line, or having someone come to meet us to do an assessment, we're all just trying to work together to ensure your safety. And yeah, it's scary, right? Yeah, maybe we really, really don't want to call our parents because we're worried about getting in trouble. And so which one do you feel most comfortable with, right? Do you want to make that phone call together? We'll put them on speakerphone. I'll be able to speak. Yeah. And kind of share what we've been talking about. Or I can sit here with you while you do that, right? While you call the parents. Which one do you feel most comfortable with? So there's a way for you to offer options. And so that youth feels a little bit more like I have some control over what happens next, right, in regards to my healthcare and keeping myself safe. But we're still taking action, especially if someone is suicidal. Like, which one do you feel most comfortable with? You want to call Hawaii Cares, or do you want to text the crisis text line? Do you want to walk over to this office to the behavioral health specialist or to the school counselor? Which one do you feel most comfortable with? Yeah. But I think transparency is always incredibly important, especially if you are a mandated reporter. And if you're upfront, I think sometimes people are hesitant to tell youth that because we don't want to deter them from opening up and being honest with us. But if you are upfront and honest, and you have a youth who's in crisis and you have to make that phone call, you know, that's not news, right? This isn't something that's coming out of left field or out of the blue for them. They knew that this process was going to happen. And also, if you have a youth who knows that this is the process and this is why it's in place, and they're still coming to you and opening up, right, about having thoughts of suicide, that's a huge ask for help. Yeah. And so we got to take action to keep that youth safe. So I think the best approach for that is being honest and transparent about what could potentially happen, and then supporting it with this is for you, right? This is to keep you safe. It's not meant to get you in trouble by any means.
Thank you so much for that answer. I really liked what you said about options. I feel like that is so incredibly important about working with any client, really, just making them feel as if they're in control, that they have a say in what they're doing. Okay, if there are any questions, please leave them in the chat in the QA box.
And if there aren't any questions right now, that's okay. If you're anything like me and like you attend a conference or presentation, it takes time for me to like process information. So I think of questions like later that night when I'm taking a shower, I'm like, oh, I should have asked this. Yeah. So if those questions pop up after today or after this presentation, feel free to reach out. Again, general contact is on the slides there. My personal contact will be made available to any kind of general questions we can answer for you, or resources we can point you to. We'd be happy to at Mental Health America of Hawaii.
Okay, if there are no questions, I think we can wrap up. I want to extend a big mahalo to Amanda for being our trainer today, and a few reminders for those who are still here. This training was recorded and will be uploaded on the Public Health Training Hui YouTube channel. You can also find all our previous training sessions there. To receive continuing education credit for today's webinar, please complete the evaluation form that will be emailed to you. This evaluation must be completed by the end of business day, Wednesday, September 25th. After completing your evaluation, certificates will be emailed to you by the end of business day on Friday, October 4th. If you have not received your certificate 2 weeks after this training, please email me at Melia, MELIA, at hifi.org, and we can help you figure that out. So just to reiterate again, I will be sending out a thank you email shortly, and it will contain today's slides or the recording of today's webinar and a link to the survey. And if you want to receive continuing education credits, please complete the survey by this Wednesday. That is all for me. We hope you join us for another training session. Aloha and take care.
Bye, everyone. Thank you.